Tank Dell of the Houston Texans suffers a significant left knee injury on Saturday. Welcome back, everyone. My name is Dr. Stephen Wilson, and here on this channel we analyze the video to understand the mechanisms of sports injuries. So if that's the type of content that interests you, then please consider liking and subscribing to this channel. On Saturday afternoon, Houston Texans receiver Tank Dell suffered a significant left knee injury. We'll try and unpack the video here to further understand exactly what happened here, and we can learn from this. In the end zone here, we see Texans receiver Tank Dell. He's going to make a play on the ball. He's going to make the reception, and he catches it for the touchdown, but he has some friendly fire coming in here from his teammate, number 14. He's falling into the prone position here, but it's his left shoulder that's going to make contact with Tank Dell's left knee. We'll play the replay through. We don't see a whole lot on this angle here. Dell does remain in possession of the football, but he immediately starts grabbing for his left knee here. We can further understand a bit better on this replay here. We'll slow it down just a bit. Again, we see number 14. He's going to make contact here with Tank Dell's left knee. And when he does, he's going to bend his knee at a very awkward angle. The angle is going to be backwards in an extended or a hyperextended position, and it's also going to bring a valgus stress, which means from the outside to the inside, stressing the outside part of his knee. And again, from here, Tank Dell goes down, immediately grabbing at his knee. In this position, when his teammate makes contact with his knee, that is going to compromise multiple structures in Tank Dell's knee. When his knee bends backwards, right there it's hyperextending. That's going to compromise his posterior cruciate ligament, or his PCL, his anterior cruciate ligament, and possibly his medial meniscus. That's the soft, spongy cartilage and the foam rubber kind of, so to speak, in between his tibia and his fibula in his knee joint there. So there's the impact on his knee. That's going to compromise his PCL, his ACL. Now remember, we talked about that lateral force coming in from the outside, that valgus stress. That will also compromise his MCL, his medial collateral ligament. And with that much pressure and that much force, certainly a fracture, perhaps to his shin bone, the tibia, the more proximal or closest to the knee area there is called his tibial plateau. That would also be a consideration for an injury here. So when Tank Dell rolls over, this is the squeamish part here. Right here, we can see the alignment of his knee. His knee is a hinge joint. A hinge joint goes back and forth in the same direction. We can see how his foot, his lower leg, his shin, it's deviating over to the outside or to the left here. That is not proper alignment for a knee joint. So it is a laundry list of differentials here. We're looking at his MCL, his ACL, possibly even his PCL, his meniscus. There could be a fracture, and when you combine all of those structures together, you run the risk of what's called a knee dislocation. Now, with this much instability that we can visually see in Tank Dell's knee, with that much instability, we know there is going to be multiple structures that have been compromised in his knee. And when you have multiple structures being compromised, that increases the instability, that increases the risk for a full dislocation of the knee joint. Tank Dell was transported to a local hospital after this incident for further evaluation. When that happens, typically there is a significant risk involved, typically with a fracture or a dislocation, and anytime those things happen, those injuries do occur, then we're worried about the arterial flow to the knee and to the lower leg. If that is compromised, that can be very significant. Hence, he was transported to the hospital in order to deal with any of those issues. We're going to take a look at the anatomy screen so we can fully appreciate exactly what we're referencing here. When we look at the skeletal model, we're looking at the left leg of the skeleton. We can pretend this is Tank Dell in the end zone making a great catch in which he maintains possession of the football. But remember, there's multiple structures at play here in the knee that has been compromised. As he was making the reception, his teammate, number 14, came in with his right shoulder making contact with the outside of Tank Dell's left knee in this manner. From that direction, making contact with his knee, bending his knee inwards in what we call a valgus stress or a lateral to medial stress. When that happens, the inside part of the knee is going to be tensioned and the outside part of the knee is going to be compressed. So the inside, we have your MCL, we have your ACL, your PCL that we mentioned, that soft foam rubber, that squishy meniscus, that cartilage right there, and then the tibial plateau, which is at risk of a fracture, that would be the proximal area right here. When we have multiple possible injuries like this, that's what leads to a full knee dislocation, which occurs when you have multiple structures being compromised in the knee. This is a significant injury to Tank Dell. He will miss the remainder of the season, which is very unfortunate. Last year, he had a fractured fibula, which prematurely ended his season as well. We really hope Tank is doing well and he's in great hands at the hospital. Thank you very much for watching. I hope this was interesting and that we learned about knee stability here today. I appreciate your time. Take care.